today's session, we are going to be connecting with Tina, who is a physician. And I would like to welcome Tina. And the very first thing I would love for you to share right now is just your background. So where did you start your college degree and your college journey? And then how did that transpire into your medical pathway here? So if you wouldn't mind just kicking it off for us, that would be great.
So I went to the University of Michigan for college, and while I was there, I majored in brain behavior and cognitive science, which is like a biopsychology, like biology type major. But then I also had enough credits to minor in biology, and I also minored in women's health because that was an area of interest for me. I did some research with maternal child health and obesity while I was in college. And while I was there, I studied for the MCAT and applied to medical school. And then I went to Wayne State University in Detroit for medical school. I'm from Michigan originally, so I did all of my training there. And then I moved to Wisconsin to do my residency at the University of Wisconsin in Madison. And now I live in Sheboygan and I practice here and in Manitowoc and in Green Bay.
Awesome. Great. And you love Wisconsin, right?
I do. It's pretty similar to Michigan, so it wasn't too hard of a transition for me.
That's awesome. Okay. So that brought you to Wisconsin. And
Yeah.
can you share a little bit more about your role now?
Yeah, so here in Wisconsin, I work in a family medicine clinic. So I work at two different clinics. I kind of split my time 50-50 between the two clinics, doing primary care. So in family medicine, we see all ages, so babies through as old as you can get. And then I also work in the hospital up in Green Bay. And I do kind of week-long shifts working in the hospital as a hospitalist. So I see any hospitalized patients. I like to have a bit of variety in my practice. And so that's how the balance that I found to kind of keep things interesting, keep my knowledge and my skills up, and to be able to address kind of any concerns that patients may have.
Okay, excellent. So Kennedy was wondering in the chat, so what are the exact requirements to get into your role? So I know you went to medical college, but then what are some of the other things that happen after medical college as far as like the exams and the clinicals and all that fun stuff? So if you could share a little bit more about that, that would be helpful with this group of students.
Yeah, so every medical school has different requirements, but in general, you need to have a certain number of credits in biology, chemistry, physics, and then also credits in things like psychology and the humanities, English or history. Every school is different, and I truly don't remember all of my specific credits and qualifications, but you definitely have to have a strong science background. That doesn't mean that science needs to be your best subject. I'm definitely a little bit more humanities based, which is why one of my minors was in women's health, which was kind of in the women's studies department. And you have to do those requirements in terms of classes. There are certain credits that you have to do, but then medical schools also like to see a variety of like volunteer work or research. And so that's why I did some research in women's health department with maternal child obesity and feeding practices. Other things that medical schools like to see are that you have some sort of like experience in the medical field to make sure that you know that it's the right fit for you. The way that I did that is I knew from probably middle school that medicine was something that I was interested in. And so when I was in high school, I looked for shadowing and volunteer opportunities, which I know right now with the current pandemic may be a little bit more difficult to find, but maybe in the next year or two, things will be different. And then when I was in medical school, I also did some volunteer work at the hospital and in doctor's offices just to make sure that it was still the right fit for me, because it is a big commitment. And so definitely better to do research ahead of time and make sure that you want to commit to it. It's a long process, so you definitely don't want to be unsure if you decide to go that route.
That's good. That's good. So a lot of the students, and I think this is almost across the entire healthcare profession, a lot of students are intimidated by this MCAT, this test that you had to take. So if you could share your experience with that process, like was it a lot to study for? The students are wondering for how did you manage that exam?
Yeah, the MCAT is a big exam. I definitely will not minimize that, but I think it's really doable. A lot of the prerequisite classes that you have to take to get into medical school are subjects that are covered on the MCAT exam. So the classes that you're taking throughout college are already helping you study for that exam. In addition, there's a lot of like books and online question banks and resources to kind of look at those specific questions. So if you've had to take like the ACT or the SAT, you know that there's specific study guides for those tests. Same thing with the MCAT. The way that I tackled the MCAT is I took it in June and my semester ended in late April. So I took like 2 months really to just study. I had a group of friends who were also taking the MCAT, and we would spend, unfortunately, many hours per day in the library studying. It is a lot of work, but you're definitely learning a lot. And it's really good practice for just being committed and being dedicated to reaching a goal. So I won't say that it's an easy test, so you can't just walk in one day and decide that you want to take it, but there are a lot of resources available, and the classes that you're taking for your pre-medical requirements are helping you study for it as well.
Yeah, I know. I think everyone just in general has fears of examinations, and that one attempt to be able to show all that you know. So I'm sure that can be a stressful time in your life. And speaking of that, like, some of the students they're curious about just overall, how did you balance everything throughout this process? So what if you have a family that you're taking care of kids during this process? How did you just overall balance that life and that school portion while you were going through med school?
Yeah, I think time management is super important and a really, really great skill to have in place or to even work on while you're going through whatever field that you want to do, whether it's medicine or something else. I find that I need a paper planner with to-do lists and schedules. Everyone's different. You really have to find what works best for you. But for me, if I have a list of tasks that I need to do that day, I prioritize, my top 3. And no matter what, I have to get those top 3 on my list of 10, let's say, done before I can, do fun things. But at the same time, know that taking care of yourself and your body and being around your family is also really good for your mental health. And you can't be studying for the MCAT or for your classes or doing clinicals if you're burnt out and not resting. So really, sometimes one of the things on my top 3 might be to spend an hour exercising for, my own mental health. So really trying to find a balance. But for me, writing my list of to-dos and prioritizing and then having schedule. I live by my Google Calendar. So that's another thing that I found to be very helpful.
Yeah, I agree. I'm at the point in time in my life as well as if it does not make its way onto the calendar, I will not show up for whatever it is. I think that's something that as you grow and get older and as you get involved in more things, like being organized at how you schedule and manage your time is a skill that I'm sure you have to work on, but a lot of professionals have to do as well. So now most of these students that are tuning in are in the high school arena. So a couple of questions around like the things that you said that you were doing in high school. And I know you mentioned that you already had an idea in middle school that this was something that you were interested in. So what did you do while you were in high school to help you prepare for this role? And then also, tying into that too, like, did you get any college credits already while you were in high school too, to maybe minimize some of that time in your college training?
Yeah. So before I forget, I'll just say about the college credits. I did some AP classes in high school. And so I was able to test out of like my first semester of chemistry, general chemistry in college. I took AP psychology. So I tested out of like the first psychology course in college. So that was helpful. And I think that's the reason why I was able to have a couple extra minors on my college degree, because I had tested out, but that's definitely not a requirement. I have plenty of friends and colleagues who didn't have any AP classes or college credits when they started, and it's totally doable to be pre-med during that time. So don't stress out if that's not something that you have, if it's not available to you. It was just a nice bonus because it did happen to be available at my high school to get some college credits through there. And then what I did in high school is, first, when I was like in the earlier years of high school, still trying to figure out for sure what I wanted to do, I volunteered as like a greeter in my hospital. that I lived nearby. And so just kind of getting the feel of the hospital environment, getting a little bit more experience with that. And then one of my own personal physicians that I had a relation, I had been seeing for many years, when I was a little bit, and I think it was sophomore or junior, I asked him if I could shadow him in the operating room and in clinic, and he was nice enough to allow me to do that. That was actually very helpful because it was my first inkling that maybe becoming a surgeon wasn't for me, because I enjoyed the in-clinic experience a little bit more than the operating room experience. So nothing that I was doing in terms of like seeing patients on my own or anything like that, but any sort of shadowing, just getting involved is really helpful. And then I also had thought for a bit of time, let me make sure that medicine is what I want to do. So I did also look into shadowing and doing some other experiences for other fields that I was interested in, just to see if that would help as well. And that did confirm that I felt like I wanted to do medicine.
Great. Excellent. So thinking about that and landing on where you did now with your role, like how did you decide specifically to become a physician and a hospitalist as well? How did you figure out that that was going to be a good fit for you?
A lot of the specifics I realized during medical school, because you do a lot of different rotations in different fields. But I knew from the research and the volunteer work that I was doing in college, as I said, I was looking at maternal child relationships and how they contributed to obesity later in life. That was kind of my research that I did for 4 years. And so that really got me interested in how family relationships and dynamics affect overall health. So that's kind of how I got started into thinking about family medicine as a field, because family medicine sees children and adults. And a lot of times, a lot of my patients are a family unit. So I will see the kids and I'll see the parents and the grandparents as well. So that was part of how I decided that that was a specific field that I wanted to do. I actually didn't think that I wanted to do any hospital medicine when I first started out. Even when I was in my residency training, my plan was not to be working in the hospital, but I did, you have certain requirements that you have to do for medical school and for residency, which is the next step in training after you graduate from medical school. And the more time I spent in the hospital, the more I really enjoyed it. I thought it challenged my brain in a different way. And I think that it makes me a better outpatient clinician, because I see, patients when they're very sick. And so when they come in for in-clinic follow-up from a hospitalization, I have a lot of understanding of really what went on during that hospital stay, because I work in the hospital as well. So I felt that it would add to my value as a primary care clinician. And that's the reason that I decided to do that. But as I said, that was a pretty late in the game. It was probably my second or third year of my residency that I decided that I wanted to pursue hospital medicine as well.
Great. And this one isn't actually a question from a student, but this might help me. So like as a hospital physician, like do you work in like what department do you work in? I guess I would like some more clarification on that.
Great question. So the way that I do hospital shifts is I'll work 7 days in a row, and I work after the emergency room doctor sees a patient and says, this person is sick enough that they need to be admitted to the hospital for further care and treatment. Then they will call me or whoever, the hospitalist who's on call that day. And they'll say, I need to admit a person to the hospital. They're in the emergency room right now. And so then we'll go down to the emergency room, we'll see them, we'll, put in orders, and then we'll follow them for the rest of our week that we're working in the hospital. If they get admitted to the intensive care unit, there's specific intensive care doctors that work at our hospital who would then see them there. But in general, that's how the hospital that I work at is structured. A lot of hospitals are structured in that same way. Sometimes we'll get transfers from smaller, more rural hospitals where we'll get a phone call from a doctor, at a hospital 2 hours away that says, we don't have the enough resources here to care for this patient. will you admit them to your hospital? And that's another way that we'll see them.
Okay, that's excellent. That helps me understand a lot more. Is that like a common dual role that a lot of family physicians also work as hospitalists, or is that pretty unique, the way that you've carved both those roles out?
Yeah, so traditional family medicine is kind of that, small town rural doctor who sees everyone and does everything. So traditional family medicine will also do OBGYN care and deliveries and see hospital patients. So that's how family medicine started, 50, 100 years ago. But now as we have, more patients to see in clinic, more people to see in hospitals, and especially in more cities, that's really not the way that traditional family medicine works anymore. So it isn't quite as common to work both in the hospital and in clinic. And it's also not quite as common to do deliveries anymore. Like I don't do any pregnancy care or deliveries. But I have friends who work in smaller regions of the country, and they do all of that. Within my practice group, I am currently the only physician in our group that does hospital and outpatient.
Okay, that's good to know. So one of the things we like to share with students, and part of the reason why we want you to go out and try as many things as possible while you're in high school, is that it helps you not only let you decide what things you like, but you're probably going to have experiences where you're like, yeah, this is definitely not a fit for me. And I heard you say that about shadowing a surgeon. So if you could share with these students, like, what was it about that surgical career that you're like, no, this is not for me? Because I think that's helpful for them to understand some of that thought process too.
Yeah, great question. So I think for me, and this kind of goes along with the communication skills that you guys brought up at first, being able to communicate with patients, form lasting relationships with patients. That was the reason that, I realized in surgery, it's definitely more, the person's under anesthesia. You can't really have that conversation. The other field that I didn't love was emergency medicine, because generally you see a patient once and then you don't see them again. So I really wanted to be able to, form lasting relationships with my patients and their families, and be able to see people over a period of time and help with overall health. But I think it really depends on your personality. And that's why it's really nice that there's so many options out there. Because what's right for you might not be right for someone else. Someone might love that fast paced aspect of the emergency department, or really like the hand-eye coordination that is required with surgical skills. So it all definitely depends on the person.
Okay, yeah, that makes sense. And again, you're right. That's going to differ based off of what gets you excited every day, and the different pieces of the field that you like to bring in. So we did have a student that is interested in the field of medicine, but they're not sure, like, to decide between going the patient care route or the research route.
Mm-hmm.
So if from your experience, how would those roles differ? And then maybe why did you decide? I mean, I've heard you say over and over that you really like building those relationships. And I'm wondering if do you still incorporate some research into your practice as well?
Yeah. So I don't currently I'm not currently working on any research projects. One of the things that I like you said, is the forming relationships, but research is really, really important in medicine and science as well. Um, you can definitely be a physician and still have a research position. Generally, if you work for like an academic medical center, like the University of Wisconsin-Madison or the University of Michigan, part of your role is to do research. So if I was working at the University of Wisconsin, for example, most of those physicians are also involved in research. So there's definitely a way to be able to do both. The thing to keep in mind is that research is very important, but you're just not seeing patients face to face. The research that I did was seeing people. I was interviewing moms, we were watching them feed their kids, we were doing work in person, but we weren't making like treatment plans to change their eating habits, for example. Whereas in clinic, if I see a child who's overweight or obese, I'll talk to the family about what adjustments we can make to their lifestyle to work on that.
Awesome. Well, thanks for that. So let's start talking about just your day-to-day life. a lot of the students, we actually have a handful of questions where they're just trying to get an understanding of like, what does a typical day look like for you? And it sounds like week by week, it may be dramatically different based off of being in a family physician world versus the hospitalist world. So if you could just share, let's start with the family physician world. Like what does a typical day look like for you in that role?
Yeah, so generally my clinic hours are from 8 a.m. to 4:30 p.m. with a lunch break in between. I'll generally see between 14 and 19 patients per day. And some patients are follow-up visits from chronic medical conditions that we've been monitoring. I'll see new patients. I'll see people who come in for their routine physicals, so they don't have any specific concerns, but we're just kind of making sure we have preventive health in place. So cancer screenings, lab work, things like that. I also do some virtual visits now, especially since the pandemic. So I'll either have phone visits or video visits. Part of my in-clinic practice is also seeing patients virtually who are recently discharged from the hospital with coronavirus, and we just want to keep a close eye on them. So I'll see them for the first 5 days after their hospital discharge, and we'll do that virtually with video visits. But there's a huge variety of the types of people that I see and the concerns that they come in with. So that definitely makes every day completely different, which I really like. And then I work at 2 different clinics. So the structure of both clinics is pretty similar, just in different towns.
That's good. So what is when you look at your role, like what would you say is the thing that you enjoy the most about your job? And maybe it's more than one thing, and that's okay if you have more than one thing to share, but students always like to know, like, what do you love the most? And then I'm likely going to follow up with the opposite of that question as well.
What I like the most is, if someone's having like an issue or concern, like I see a lot of patients with like mental health issues or substance use issues. So something that's really very intrusive to daily life, working on a treatment plan together and, seeing weeks or months down the road, really improvement and change in quality of life. That's really rewarding for me and kind of makes me keep doing what I'm doing. That's definitely one of my favorite things. I also love seeing kids growing up. That's really fun, just to kind of see them from birth to, a few years down the road. It's just fun to see their growth and development. So those are probably my favorite things.
Do you have a favorite age group that you like to work with then? Because I mean, you see everything from young to old. Do you have a favorite?
Well, I mean, I think like 6 to 9 months are really fun to see, but that's not really much in terms of like, usually they don't have a lot of medical issues at the time. It's just fun visits, ways to break up the day. But I think it's really cool to work with patients who are, in young adulthood, first starting to like, create their family, talking about, family planning and contraception and just overall health and nutrition and physical activity, and how that can kind of create those healthy lifestyle patterns that can hopefully provide a healthy life for years and years to come. So that's fun too.
That's good. That's good. We have a question, a student in here. You've talked oftentimes about eating healthy, and you don't have to answer this, but one of our students is asking if you're a really healthy eater as well, not just sharing that with your patients.
I had a snickerdoodle cookie last night. Like I definitely enjoy my treats, but the work that I did in college and medical school, I've seen that a lot of chronic medical conditions can be prevented or treated with lifestyle. I'm not someone who pushes like medication for every concern. I think if you can make those healthy lifestyle changes, that's going to be better for you in the long run.
Yes, agreed. Making those healthy choices definitely can provide a better overall quality of life. So flipping the whole what you love about your job on its head, like what do you find are the most challenging or most stressful things about the work that you do?
I think you'll probably hear this from most doctors that you talk to, like dealing with like insurance companies and documentation. Insurance companies will sometimes put restrictions or like kind of hurdles to get like medications or treatment plans just because of the cost. And I definitely understand trying to reduce healthcare costs, but a lot of times it's more like just an unnecessary red tape. So I kind of hate that. And then documentation, like you guys were talking about with communication skills, documentation is super important because that communicates to other clinicians who might be taking care of the patient, like what we talked about, what our treatment plan is. We definitely use some medical language that, most people will have access to their notes online if they have like online portals through their healthcare system. So just understanding that the documentation that we do is usually doctor to doctor and not necessarily in like layman's terms, but sometimes we'll have to clarify that with people. And then there are just certain documentation requirements that sometimes they're just a little frustrating to have to do every single visit. I'll see a full day of patients and then I try to get my notes done, but sometimes that can bleed into, a couple hours later.
Yeah, agreed. And that brought up another question from one of our students, because they had heard that you work in 2 clinics and then also in a hospital setting. So how do you juggle all that work? And I think maybe help them understand that, how does it work with, like, is there a patient load that you max out on? Like, how do you not just get bogged down? And then what do you do at the end of your workday? Are you expected to bring some of that work home to complete some of that extra paperwork and all these other things that come with the job?
So the clinics that I work at have like multiple clinicians. So when I'm not in clinic, then if a patient needs to be seen, one of our other clinicians, whether that's another doctor or a nurse practitioner or a physician assistant, will see the patients, and then we'll communicate through our documentation or, a quick page or phone call or something like that. That helps manage the load being in 2 different clinics. When I'm working in the hospital, I'm not seeing any patients in clinics, so if they need to be seen, then one of my colleagues will see them. And then I'm available like through our kind of like portal to answer questions, like if the nurses have questions or if a patient has any concerns that come up while I'm working in the hospital. And I really try not to bring work home. I try not to work on weekends. I will generally just come to work like, 30 to 40 minutes before the day starts and catch up on anything that I might have left behind. And then maybe we'll stay an extra 30 or 40 minutes at the end of the day. But then that way, when I leave the office, like I'm really only working while I'm in the office. It's a little bit different right now because, as I said, I'm doing some of those virtual visits with our hospitalized patients who had coronavirus. We're seeing them for 5 days in a row after they are discharged from the hospital. So I am I'm doing some virtual visits on weekends right now, but hopefully as our hospital volumes decrease, then that workload will go away as well.
That's good. So students, we only have probably a couple more minutes left. So if you have any last questions that you want to get answered, make sure you type them into the chat box now. And I have 2 more for you. There have been a couple of questions around just impacts and changes that have happened because of coronavirus. So how has your practice changed with this pandemic that's happening right now?
Yeah. So obviously we're wearing like masks and eye protection with any patients that we see. And if anyone has symptoms of coronavirus, we're encouraging them to get tested before they come into clinic to potentially, we don't want to potentially expose anybody that doesn't need to be. So that's one of the biggest changes. We're also offering more virtual offerings like phone or video visits, both for people who have symptoms of coronavirus or tested positive. Then that way they don't have to come into clinic, but we can still provide medical care. And then some patients are just not comfortable coming into clinic right now, even with our safety precautions in place, which is definitely understandable. So we're also offering virtual visits there. So that would probably be the biggest way that things have been affected. And then, as I said, I'm, doing some of those virtual visits for recently discharged patients as well.
Okay, that's good. And we've got 2 more quick questions that came in. One is around that MCAT. So Abby was wondering, do you take the MCAT between undergrad and medical school, or do you take it after medical school to start your career? And I believe it's between your undergrad and med school, right? That's your entrance into
So
med school.
you take it before you apply to medical school. So generally, if you're gonna go straight to medical school after undergrad, you'll take it like your junior year and then apply for medical, or like late junior year. Don't quote me on this, but I think it's, sometime in your junior year of college. And then in medical school and after medical school, then you have like board exams to be certified as a physician, which is different.
Okay. Good. And then I think this is a legitimate question right now with younger students is what if like in your life right now you are squeamish around like blood and just anything that you might deem as gross from the human body?
Yeah.
Is that something that you just overcome with time, or is that like if you can't handle this now, like that's probably not the path for you?
That's a great question. So it's funny because like I definitely don't love seeing like wounds and blood, but my brain thinks of it really differently if it's like in a work context versus like if my husband gets like a cut at home, But I think if you're, really squeamish, maybe like a surgical specialty isn't the right one, but you don't know until you check it out. I don't see that much like blood and gore in primary care outpatient clinic. Sometimes urgent care will see a little bit more, cuts and scrapes and wounds. So I would say don't rule out medicine if you're a little squeamish. I'm not the one doing like the blood draws or giving the shots. That's usually like the nurse or the lab tech. So it's definitely different levels of exposure.
Okay, that's good to know. And that was one of the things I immediately, when I was younger too, thinking about my future career, I'm like, well, I don't like blood, so obviously a career in medicine won't work for me. But okay, so just looking back at, I guess your path here, and for all these students that are starting to just look forward as to where they're going to go with their life, what advice would you have for them, being in high school now, if they are interested in a field inside of medicine? Like, what are the things that you really think they should be doing now and throughout the rest of high school and college to be ready for this type of role?
Yeah, definitely in high school, you don't have to be sure of your path by any means. It's really a really great time to explore. And even through college, like especially the first few years of college, just kind of exploring your interests. If you think that you're interested in medicine, I cannot emphasize enough like shadowing or talking to people who are in the field. Programs like this are really great as well. And then knowing that there's a lot of different like options within medicine, both doing things like clinical patient work, different specialties within medicine, research, like you mentioned, nursing. So, really, just kind of getting exposure would be the biggest thing if you wanted to, like, read books about the field. And then just, working hard in school and getting those time management skills in order, especially in high school. It's a lot different when you get to college and you have a lot more free time, but you have to like learn how to manage that. So the more practice you get with that, the better. I think it just, makes life easier down the road.
Awesome. Thank you for that. So, students, I did type into the chat box a survey today. So this session was sponsored by the Northeast Wisconsin Area Health Education Center. And they have a feedback survey just to gather your insight as to how beneficial this was for you and getting information that you need about this. And we do have a student that's asking about if we have more questions, where should we go? And I would just encourage you to reply to us at Inspire, and then we can help you get in contact with the right person to answer any further questions that you might have today. And then also as a reminder, those huddles on your Zello platform will connect you to other professionals in that specific career. So if you do have more questions, feel free to reach out onto the Zello platform or just directly to us. So again, thank you, students, for tuning in today. Thank you so much, Tina, for your time. This was really great to learn about your careers, because you really do have two careers going on here, and it's fun to learn about the different opportunities that are available for students. So thanks again for your time, and good luck, dealing with the rest of this stressful time in the pandemic. And thank you for all that you do to help protect our population here and get them better.
Thank you.
Okay, bye everyone.